If you or a loved one is facing kidney disease, home hemodialysis might offer a more flexible treatment approach. This treatment approach allows patients to gain the ability to manage their kidney health right from the comfort of their own homes. Whether you're considering renal care alternatives or aiming for improved treatment convenience, home hemodialysis offers greater flexibility and independence compared to in-center hemodialysis. Here are the key details about home hemodialysis. Number 1. Training and education. Training and education are important aspects of home hemodialysis, ensuring that individuals learn key skills and knowledge to perform the tasks necessary. Patients starting on home hemodialysis undergo comprehensive training, typically guided by experienced healthcare professionals. This training covers a wide range of critical topics, from learning to operate the hemodialysis machine and preparing dialysate to vascular access care and infection control practices. Patients are also educated on monitoring vital signs during treatment and emergency procedures. They receive ongoing support from their healthcare team, reinforcing their competence in managing home hemodialysis effectively. This education equips patients with the tools they need to manage their kidney health from the comfort of their own homes. Number 2. Frequency and schedule. Home hemodialysis offers customizable treatment schedules, providing greater flexibility compared to in-center hemodialysis. Two common options include daily home hemodialysis and nocturnal home hemodialysis. Daily treatments are shorter, lasting 2 to 2.5 hours per session, and are performed 5 to 6 times a week, ensuring consistent waste and fluid removal. Nocturnal home hemodialysis, on the other hand, features longer, milder treatments of 6 to 8 hours during the night while the patient sleeps, allowing for increased daytime freedom. The choice between these schedules depends on factors like the patient's health, residual kidney function, lifestyle, and medical guidance, with patients receiving training to independently manage their chosen treatment plan. Customizing the hemodialysis schedule in a home setting empowers patients to align their treatments with their unique needs and preferences. Consulting with healthcare professionals ensures the selection of the most appropriate home hemodialysis schedule based on individual circumstances. Number 3. Equipment and supplies. Home hemodialysis requires specialized equipment and supplies for a safe and effective treatment. Patients receive a dedicated hemodialysis machine designed for home use, along with dialyzers that facilitate waste removal. Dialysate solution is provided, and patients learn how to prepare it for each session. Tubing and needles connect the patient's vascular access to the machine, ensuring proper blood flow. A water treatment system maintains water quality standards, and additional supplies may include access care materials, personal protective equipment, waste disposal items, cleaning supplies, and backup equipment. Proper training and regular supply deliveries, along with ongoing healthcare team support, are essential for successful home hemodialysis. Click the like button if you're getting value out of today's content. Number 4. Monitoring and support. Monitoring and support are integral to the success of home hemodialysis. Patients benefit from a remote monitoring system that allows healthcare professionals to access real-time data during treatments, enabling immediate adjustments if necessary. Regular checkups, both in person and through telehealth, help assess overall health and monitor treatment, complemented by routine lab exams. Patients receive ongoing education to stay informed about the latest developments and best practices, ensuring their confidence in managing treatment. Troubleshooting guidance, adjustment of treatment plans, emergency procedures, and psychological support contribute to a comprehensive care approach. Caregivers in home hemodialysis provide vital support for patients with medical conditions or physical limitations. They're trained to assist with machine setup, monitoring, and medication management, ensuring patient safety and emotional support. Caregivers also aid in the documentation and communication with the healthcare team. The level of involvement depends on the patient's needs, with the goal of enhancing well-being and treatment while promoting independence. Number 5. Independence and quality of life. Hemodialysis, whether administered in a clinical setting or at home, has a significant impact on the patient's independence and quality of life. In-center hemodialysis, while providing immediate access to healthcare professionals, can limit a patient's independence due to fixed treatment schedules and the need for frequent visits to a dialysis center. This may disrupt their daily routines, limit dietary choices, and affect their overall quality of life. In contrast, home hemodialysis offers greater independence and flexibility, enabling patients to choose when to perform treatments and allowing them to lead more normal lives. It enhances their quality of life by reducing their constraints imposed by in-center treatments, offering more dietary freedom and fostering a sense of empowerment. Patients on home hemodialysis can engage in work, travel, and social activities with less disruption, ultimately contributing to an improved quality of life. The choice between these two forms of hemodialysis depends on individual circumstances, eligibility, and the patient's preferences for treatment and lifestyle. Subscribe to support the channel's growth if you're getting value from the content. Number 6. Benefits and considerations. Home hemodialysis presents several notable benefits for individuals with end-stage renal disease, ESRD, or severe kidney dysfunction. This approach offers increased flexibility and convenience, enabling patients to schedule treatments at their convenience and potentially leading to improved overall health. Home hemodialysis reduces the need for travel to a dialysis center, saving time and expenses, and fosters improved quality of life, as patients can maintain independence and the sense of normalcy. The personalized nature of home hemodialysis, along with closer monitoring and remote support, enhances patient safety and the potential for better clinical outcomes. This approach empowers patients to actively engage in their care and may offer a more convenient and effective treatment option, particularly for those who are eligible and prepared for home-based treatments. Number 7. Requirements. Patients pursuing home hemodialysis must address specific home environment requirements to ensure safe and effective treatment. This entails designating a dedicated space with electrical accessibility for the hemodialysis machine and securing ample storage for supplies. Reliable access to clean water is vital given its role in the dialysis process, and proper drainage for waste disposal is equally crucial for a hygienic treatment environment. These considerations emphasize the significance of a well-prepared home setting, enabling a seamless incorporation of life-sustaining hemodialysis into the patient's daily routine. Number 8. Eligibility. Eligibility for hemodialysis is primarily determined by a patient's medical condition and kidney function. It's typically considered when an individual's kidney function drops significantly, indicated by the glomerular filtration rate, GFR, of 15 milliliters per minute or lower. Severe symptoms like fatigue, nausea, swelling, and high blood pressure, along with fluid and electrolyte imbalances, often prompt the initiation of hemodialysis. It's important to note that hemodialysis is not a one-size-fits-all treatment, and eligibility is determined on a case-by-case basis. Patients who meet eligibility criteria for hemodialysis undergo thorough assessments by a nephrologist to determine the most appropriate treatment plan, which may involve hemodialysis, peritoneal dialysis, or kidney transplantation. Hemodialysis serves as a life-sustaining therapy for individuals with end-stage renal disease, ESRD, aiming to improve quality of life and manage severe kidney dysfunction. It's part of a broader range of renal replacement options, and its eligibility criteria are assessed individually to ensure that patients receive the most appropriate care tailored to their unique medical needs. In summary, home hemodialysis is a viable option for individuals with kidney failure who seek greater flexibility and independence in their dialysis treatment. It offers numerous benefits but also comes with responsibilities and considerations that should be thoroughly discussed with healthcare professionals to determine the best approach for each individual. Check out this playlist about kidney donation. If you've gotten value out of today's video, give it a thumbs up, leave a comment down below, I respond to all of them, and consider subscribing to the channel to get more valuable related kidney content. And I will hopefully see you, in the next video. Take care.